Hi, my name's Brian. I work at Unity Hospital. I've been there for 29 years as a EEG technologist. Um, I'm part of the Unity negotiating team.
Hi, I'm Elaine from Owatonna, surgical tech. Been there for 13 years, and I am here for the negotiations to help us all to get a good contract.
Hi, my name is Rocky Doby. I'm a Huck at Mercy. I've been there 9.5 years. I was elected to be on the negotiation team by members at Mercy.
Hi, I'm Sarah Reger. I'm a nursing assistant at Mercy Hospital. I've been there 17 years and I'm part of the bargaining team.
Hi, I'm Emily Martin and I work in surgical services at Abbott Northwestern Hospital. I'm not on the bargaining team, but I came down today to share some stories and perspective on health and safety.
And some of our members came forth with some very impressive stories on incidences that was affecting basically their health and safety. And we had a long discussion with Allina about it. And unfortunately, Allina wasn't too interested in hearing a lot of these stories about potential problems at the hospitals involved. So we're going to keep pressing these issues until we get safe environments for our workers.
It was quite shocking, and I think they are very serious situations that should be handled. And I also think that they just took it as blowing us off, not wanting to really acknowledge that these things were happening.
Some of our concerns that we have are the way that instrumentation is reprocessed in our sterile processing department. One of the issues that we touched on today were all of the dust bunnies throughout the facility, especially, I find it especially alarming in surgical services when dust is so prevalent everywhere.
I felt like they kind of attacked them about their stories, like, well, when did it happen? What's the date? It just, I felt like they kind of drilled them and maybe didn't take them seriously, and that they were kind of rude about it. Okay. So we had brought up today to Allina management how in the hospitals we have signs by all the elevators and entrances stating if you are sick, please do not visit patients. However, members feel that doesn't pertain to them and that they feel they have to come to work when they're sick because it could be an attendance issue and a corrective action. And we propose that if we have a doctor's note that we're contagious, that it gets excused.
One of our proposals to Allina was that the union members have a greater participation in the health and safety committees that Allina has to safeguard our health and safety. Unfortunately, right now we don't have much of an input into these issues that we would love to discuss further with the Allina management.
The employer acted very surprised to the proposals. They didn't hold a discussion, but that was what they said to us. Well, before we can talk about these, we need to investigate. We need to follow up with managers and people that were involved so that we have the full story before we can come back and sit down and give you an answer to your proposal. It made me feel like they were just blowing a smoke screen.
Okay, today we also reached a TA on the minor issues related to selections of arbitrators for dispute over our pension.
Our next bargaining date is next Tuesday, February 3rd.
What needs to happen at each facility is members need to pass out flyers, pick up buttons, get involved. On February 12th, show up at the CAT team meetings if you want a better contract.
They want to take away a lot of our hard-won victories in things we've achieved for the members of the union. And it's becoming really obvious that if we don't fight, we're not going to get any kind of good contract.
At Allina with SEIU, we have one of the strongest contracts around with standards that have been hard fought by many bargaining teams before us. I know from personal experience, the last couple of contracts, we worked really hard to maintain these standards that are so important to our working families across Allina. And last couple of contracts, Allina has really tried to take away a lot of our language and standards that we fought so hard for. This time around is no different, and I know that a lot of you are dissatisfied that we're not making any progress, we're not making any gains. Well, now's the time now's the time for us to pull together and to fight for the standards that we feel that we deserve and the standards that we feel our patients deserve at our healthcare facilities. The bargaining team can't do this alone, and we all really need to work together and support each other to, if we want to gain a better contract. So anybody who wants to come and meet us down at the union on February 12th for the CAT team meeting and find out how you can support the bargaining team, love to see you there.